Hello everyone, this is Dr. Ivy, your favorite Abuja eye plug. And again, welcome to my YouTube channel. Today I'll be discussing Pterygium and Pinguecula. So I'll start by simply explaining what a Pinguecula is. A Pinguecula is a benign growth on the nasal side of the eye, which is usually yellowish. So you might notice in your eyes or a friend's eye that's on nasal side, you see a yellowish elevated mass of flesh there that is actually not encroaching on the white black part of the eye. That's actually called a pinguecula. And up here is an image of what a pinguecula looks like. So when you see it on someone else's eyes, you can actually see this is pinguecula. So far, studies and researches have shown that prolonged exposure to sun, or if you stay in the tropics, or you do a lot of outdoors, you tend to have pinguecula. And the good news is that it's not sight threatening at all. Once in a while, it gets inflamed and has some symptoms like itching, burning sensation, gritty sensation. You feel like there's sand or stone in the eyes. The eyes could turn red as a result of your exposure to sun. And you also notice that when you're also outdoors, probably smoke, you're exposed to smoke or dust or dry wind, this could actually cause or irritate the eyes and cause these symptoms. So we advise our patients to try as much as possible to avoid direct contact with sun, smoke, dust, dry wind, because these are trigger factors that could actually cause the symptoms I listed earlier. So now that brings me to another topic, um, your pterygium. Now, a pterygium looks like a pinguecula, but they're actually not the same thing. Okay, up here is an image of what a pterygium looks like. Now, I know a lot of people are familiar with this condition. You notice that it's a little bit different from the pinguecula in the sense that it's fleshy. It's a benign growth actually, but it's fleshy and it's triangular in shape. And most times it turns red when you're exposed to sun, dust, and smoke. You just, from the image here, you can see that it's fleshy. It's not like the pinguecula we saw earlier. The same factors or the same cause for your pinguecula is the same cause for pinguecula. Now the difference is that the pinguecula over time encroaches on your cornea. That's like the black part of the eye that you can see. Not necessarily because of the cornea is actually a thin transparent membrane or layer that covers the black part of the eye, so we can't really see it, but I'll just have to use what we can see to actually explain what I'm trying to say. So just like your pinguecula when it's inflamed and all, we actually prescribe non-steroidal anti-inflammatory or steroidal anti-inflammatory depending on the degree of inflammation, and we also prescribe artificial teardrops to try to keep the eyes lubricated so you don't feel the burning sensation that you feel when the eyes are inflamed. Then we also advise that you also use your UV blocker lenses. So please back to the pterygium. So the difference between the pterygium and the pinguecula is that the pterygium over time can actually affect your vision, in the sense that when it encroaches on your cornea, two things can happen. It actually affects the way you see. When it encroaches your cornea, it tries to change the curvature of the cornea, thereby inducing what we call astigmatism. So when it induces astigmatism, it causes, that's a refractive error which you need glasses to take care of. And if further down, now we have a grading system for this pterygium. So that's the job of your optometrist. He or she will know when it's time to actually say, okay, we need to remove this because it's actually affecting your vision. Now, treatment for pterygium is same as that of the pinguecula when it's at a mild stage. But when it's affecting your vision, we actually advise our patients to do what we call a pterygial excision. That is a scraping of that flesh away from the cornea so that it doesn't have more damage on your cornea. So that's what we do, and we also encourage the patient to wear UV blockers, UV sunglasses that tends to block out the UV light, so that it will reduce the inflammation that you might get as a result of exposure to sunlight, and the other factors are like your wind, dust, smoke. These are trigger factors that actually cause your redness. So I've had lots of questions, especially from patients, friends, neighbors, well wishers are like, please, I notice I have cataract in my eyes. Somebody said this is cataract. You can see from that image that's not cataract at all. Cataract has to do with the opacification of the crystalline lens in the eye. That's a different thing altogether from a pterygium. So when next someone sees you and say you have cataracts, you can say, no, this is a pterygium or this is a pinguecula. I'll also advise that if you have these eye conditions I have listed above, you should try to see your optometrist today to have a proper examination of the eye, give you the required eye medications you need, and to also check to assess to what degree your pterygium is and the necessary steps to take to prevent any issues with the eyes. I think with that said, I've been able to educate you on what it is. If you have any question or you have a comment, please comment down there, and you can subscribe to, if you found this very useful, you can subscribe with the subscribe button below, and stay tuned for more educative tips, eye tips. Thank you.